Welcome, and thank you for taking the time to watch this demonstration on the Claims tab inside the MTBC EHR. Submitting claims to MTBC is very quick and easy. Simply choose the diagnosis and procedure codes from this electronic superbill. For patients that you have already seen today, and for patients who you've already documented a clinical chart, the diagnosis codes which were selected as part of the clinical workflow will automatically feed into this claim tab. Additionally, if a procedure was selected in the clinical workflow, it will also automatically populate the Claims tab. The Claims tab can also help you choose an appropriate visit level with our E&M coder. The E&M coder will work if you've documented the clinical portions of the chart inside the Charts section. Let's go ahead and submit a claim to MTBC using the Claims tab. Here we can see that one diagnosis is already selected. If we want to say that this patient also had a headache, we can mark the appropriate diagnosis code for headache. You can see that the unspecified hypothyroidism has already been documented as diagnosis number 1 and the headache as diagnosis number 2. If we add additional diagnosis codes, we can see that they will automatically receive the corresponding number for that diagnosis code. The same is true for procedure codes. If we want to document that we've provided an immunization, we can select the appropriate admin code as well as the vaccine. We can also select an appropriate office visit code. Before we save this claim, we can review the total number of diagnosis codes and procedure codes that we've added, as well as the total expected charge for our claim. If we want to line up our diagnosis and procedure codes appropriately, we can choose the pointers and modifiers. The pointers and modifiers sections allows you to point a specific procedure code to a specific diagnosis. Additionally, you can also add modifiers. If you're ready to submit this claim, simply click the red Save button. You'll know that the claim is saved and submitted to MTBC when the Save button is no longer red.